When we look at the marketing for modern cosmetic procedures today, there is this very specific, like highly curated image that gets pushed.
Oh, absolutely. It's the whole era of the lunchtime tweakment.
Right. The prevailing narrative is basically that you can just, pop into a pristine minimalist clinic, get a quick injection, grab a salad, and be back at your desk for a 2 o'clock meeting looking effortlessly refreshed.
Yeah, it's pitched as this completely seamless, frictionless transaction. The
Exactly.
medical aesthetics industry leans really heavily into this idea of, well, zero interruption to your busy life,
Okay.
presenting these procedures almost like, a trip to the salon.
But then you apply that quick fix logic to a procedure involving one of the most sensitive, highly vascular areas of the human body, and suddenly that lunchtime narrative starts to look, well,
A bit fictional.
a lot fictional,
Yeah.
honestly.
So today we are taking a deep dive into the reality of labia majora fillers, which is commonly known out there as labial puffing.
And we are doing this for you, the listener, because if you are even slightly considering this, you really need the actual roadmap. You need the biological reality, not just the glossy brochure.
Because the brochure leaves a lot out.
It really does. We have gathered a massive stack of sources today. We're pulling from clinical guidelines from aesthetic academies, strict aftercare protocols from top plastic surgery clinics across London and the US, and we even have the official FDA safety briefings.
It is a really dense stack of material.
Yeah, it took some reading.
It did. But our mission today is very specific. We are cutting straight through the aesthetic marketing jargon to give you a highly practical, realistic guide to exactly what happens to your body the minute that needle comes out.
Because whether you achieve a great result or end up in a highly stressful situation, it entirely depends on how you navigate that recovery period.
Exactly. But before we jump into the timeline, let's make sure we're all on the same page anatomically.
Good call, just so we know exactly what real estate we are talking about here.
Right, because that is a crucial distinction to make right up front based on these clinical sources. Today, we are talking strictly about adding volume.
Okay.
This is about injecting hyaluronic acid fillers or, transferring your own fat into the labia majora. Those are the outer hair-bearing lips of the vulva.
Got it.
This is entirely different from a surgical labiaplasty, which involves physically cutting, trimming, and suturing tissue away from the inner lips, the labia minora.
Right. So our focus today is purely on volume restoration, not surgical reduction.
Exactly. Just adding volume.
Okay, let's unpack this, because to really understand the downtime, we first have to understand the biological trauma of the injection itself. I mean, I'm looking at these aftercare protocols, and the swelling sounds intense.
It is very intense.
If the goal is just to, put some volume under the skin, why does the body react by ballooning up like that in the first 48 hours?
Well, the first 48 hours are an intense biological response phase because your body is essentially responding to a localized invasion.
An invasion? Wow.
Yeah, I mean, the moment a needle or a cannula, which is basically a blunt-tipped tube used to slide the filler around under the skin without piercing as many blood vessels, the moment that enters the tissue, your immune system registers it as a microinjury.
Okay, that makes sense.
And the labia majora are incredibly vascular. They have a rich, dense network of blood vessels.
Right.
So whenever you introduce a foreign substance into a highly vascular area, the immediate side effects, so swelling, tenderness, redness, and minor bruising, those are massively amplified.
So they'll swell much more dramatically than, say, your cheeks or your lips would from a similar injection.
Far more, yes.
And most of the time, the substance being introduced is a hyaluronic acid filler. I know we see HA in moisturizers all the time because it holds moisture. Does that play a role in this initial swelling?
It drives a huge part of it, actually.
Really?
Yeah, hyaluronic acid is incredibly hydrophilic, meaning it absolutely loves water.
Okay.
As the gel integrates with your surrounding tissue, it is literally drawing your body's own moisture toward itself like a biological magnet.
Wow, like a biological sponge.
Exactly. So that initial swelling isn't just trauma from the cannula, it is the product actively doing its job. It is pulling in fluid to create that plumpness.
But I imagine that means the patient has to actively manage that fluid response.
Highly actively.
Mm-hmm.
The clinical protocols emphasize intermittent cold compresses, usually 10 minutes on, 10 minutes off.
I assume that's because the cold constricts those dense blood vessels, slowing down the rush of fluid.
That is the exact mechanism. You use a clean cloth to prevent frostbite and protect the delicate skin barrier, but the cold physically narrows the pipes, so to speak, reducing the inflammation.
Right. And the sources also mandate meticulous hygiene to prevent infection and staying incredibly well hydrated, which honestly, it seems counterintuitive to drink water when you are swollen.
It does seem backward, but hydration actually helps your lymphatic system process and flush out the excess inflammatory fluid.
Okay, looking at this strict do not list for those first 2 days, the sources are adamant. I mean, absolutely no touching, no rubbing, and definitely no massaging the area.
The reasoning there is twofold. First, your hands carry millions of bacteria, and you now have fresh, open micropunctures in an area that is already prone to moisture and friction.
Oh, yeah, that's a bad combo.
You absolutely cannot introduce foreign in the area. Second, the filler is still malleable. It has not set yet.
Like wet cement.
Exactly. Manipulating the tissue can physically displace the filler, pushing it out of its intended position before it has a chance to integrate with your cellular structure.
Yikes. You definitely don't want that. And you also have to avoid intense heat, right? So no hot showers, no saunas, no hot tubs for at least 48 hours.
Right.
Because if cold constricts the vessels, heat would widen them, flooding the area with blood again.
Exactly. Heat induces vasodilation, which completely undoes the work of the ice packs and just exacerbates the swelling.
Makes sense.
But what's fascinating here is how this extreme vascular sensitivity actually dictates what you can put in your mouth, too.
Wait, really?
Yeah. The protocols strictly forbid alcohol and caffeine for the first 24 to 48 hours.
Seriously. Think about your normal morning routine. If you get this done on a Tuesday afternoon, your Wednesday morning coffee is totally off limits.
Completely off limits.
So is your Wednesday evening glass of wine. Why are we banning the basics?
Well, both alcohol and caffeine act as vasodilators and mild blood thinners.
Oh, okay.
They widen your blood vessels and make it slightly harder for your blood to clot effectively. In an area that has just been subjected to needle punctures and is actively trying to heal those tiny internal wounds, having a double espresso or a glass of Pinot Noir increases the pressure in those vessels.
So it makes it bleed more internally.
Yeah, it can easily turn a minor, necessary swelling response into severe, deep purple bruising that takes weeks to clear.
Wow. Okay, hang on. I am looking at these clinic websites right now. We just established that your body is actively managing trauma, swelling, and fluid retention.
Right.
But I am seeing phrases like no downtime and return to work immediately plastered all over the marketing.
Yeah, it's everywhere.
If coffee is off limits, I need an ice pack on a strict schedule, and I can't even take a hot shower. Isn't calling this a no downtime procedure incredibly misleading to the average person?
It really is. This is a massive point of friction between specific medical terminology and a patient's actual lived experience.
How so?
Well, in the clinical world, downtime has a very rigid definition. It simply means you do not require general anesthesia, you do not need strict bed rest, and you do not require an overnight hospital stay.
Oh, I see.
By that very narrow metric, most women can technically return to normal, non-strenuous desk work within 24 hours.
But normal life isn't just sitting perfectly still at a desk.
Not at all. The practical reality of local tissue recovery requires significant lifestyle adjustments. Take exercise, for instance.
Okay.
The guidelines specifically call out activities like cycling, horseback riding, or heavy lifting at the gym.
Oh, I bet a spin class would be terrible.
Unbearable. When you do a spin class, you are putting direct mechanical pressure, heavy friction, and intense body heat onto an area that is actively trying to heal and hold a gel in place.
Oh, wow.
Doing a spin class 48 hours after getting labial filler could be excruciating, and the sheer stress could permanently displace the product into an asymmetrical shape.
And the clothing restrictions, the sources say no yoga pants, no tight jeans, no thongs. You really have to think about your wardrobe for that entire week.
You do.
But the biggest, most impactful lifestyle adjustment mentioned across all the clinical sources is intimacy.
Yes, there is a strict, non-negotiable ban on sexual intercourse.
Unnegotiable.
Totally. The timeline here is critical for anyone considering this to understand. Some of the lighter sources suggest a few days to a full week, but many of the top plastic surgery clinics recommend waiting up to 6 to 8 weeks for complete healing and settling.
6 to 8 weeks. That is a massive chunk of time. Why such an extreme ban?
It comes down to friction, pressure, and the severe risk of deep tissue infection. The filler needs weeks to fully integrate and become one with your tissue matrix. If you introduce intense physical pressure and friction too early, you risk shifting the filler.
Right.
Worse, you risk causing severe internal inflammation or physically pushing surface bacteria deep into the healing microwounds.
Which goes back to the infection risk we talked about.
Exactly.
Yeah.
So when you are planning this procedure, You are not just scheduling a 30-minute appointment. You have planned your social calendar, your gym routine, your wardrobe, and your intimate life entirely around this recovery window.
Here's where it gets really interesting. Everything we just outlined applies mostly to synthetic fillers like the hyaluronic acid products, things like Dyseryl, which show up frequently in these European clinical guidelines.
Yes.
But our sources also detail an entirely different approach. The natural route, autologous fat transfer.
Right, and your choice of material drastically and fundamentally alters your recovery timeline and the biological mechanisms at play.
Let's break that down. With HA fillers, the results are immediate. You see the volume right there on the treatment table.
Instant gratification.
Exactly. And then, over the next 9 to 18 months, your body's natural enzymes safely and slowly break that gel down. It feels almost like bringing a new sofa into your living room.
Okay, I like
You
that.
carry it in, you set it down, you get an instant result with minimal disruption, even if you eventually have to replace it when it wears out. But a fat transfer seems like building a home extension.
Yes.
You have a construction zone in 2 different places, there are raw materials involved, and it takes way longer to finish, but the results are permanent.
To build on that analogy, using HA filler is like sliding a water balloon under the skin. It sits there, holding its shape until it eventually degrades.
Right.
A fat transfer is actually like planting a garden or performing a skin graft. It is a full surgical procedure.
So it's much more involved.
Oh, absolutely. First, you have a dual recovery situation. The surgeon has to perform liposuction to harvest the living fat cells, usually from your abdomen or your inner thighs.
Ouch.
They purify it and then inject it. So you are recovering from a painful liposuction wound at the donor site while simultaneously managing the injection trauma at the labia.
So you are healing in 2 places at once.
Yes, and the mechanics of planting those cells are complex. Living fat cells need a blood supply to survive.
Right. They're living tissue.
Exactly. When the surgeon injects those fat cells into the labia, they are essentially planting seeds and hoping they take root. The body has to undergo a process called angiogenesis,
Angiogenesis.
which is creation of new blood vessels to feed those new fat cells. If a fat cell doesn't get a blood supply quickly enough, it literally starves and dies.
Oh, wow.
Because the body naturally reabsorbs some of that fat, usually around 20 to 30% of it simply dies off and is cleared away by the immune system. Surgeons have to intentionally over-inject the area.
Wait, they overfill the area on purpose, knowing it will look too big?
They have to, by about 20 to 30%.
That's a lot.
It is. Which means when a patient looks in the mirror after a fat transfer, the initial swelling combined with the extra fat is going to look highly exaggerated.
I can imagine the emotional toll of that can be tough.
It really is. Patients often think, oh no, they did way too much, this looks unnatural.
Yeah.
But the patient has to wait weeks, sometimes months, for the surgical swelling to subside and for that percentage of fat to naturally die off and reabsorb. Only then do you see the final permanent result.
So it requires incredible patience compared to the instant gratification of HA filler.
Incredible patience, yes.
Okay, so we've covered the expected swelling, the necessary bruising, and the weird bodily responses as the material integrates. But if I am a patient recovering at home, dealing with all this expected trauma, how do I know if what I am experiencing is normal healing or if something has gone terribly wrong?
This is so important. Distinguishing between normal recovery and a medical emergency is the most critical part of aftercare.
Right.
The FDA safety briefings in our source stack lay this out very clearly. First, let's talk about the baseline of normal.
Okay.
If you feel small, pea-sized lumps or slight unevenness in the first 2 weeks, that is usually normal. That is just the hyaluronic acid gathering water unevenly before it fully settles.
And pain.
A dull, aching sensation is also normal.
But what is the specific difference between a normal, expected bruise and a severe medical emergency? What are the actual red flags?
This raises an important question about patient vigilance. You cannot just ignore your body. The most concerning immediate risk with any injectable filler is vascular occlusion.
Vascular occlusion. Okay, what is that exactly?
This happens if the practitioner accidentally snakes the cannula directly into a major blood vessel and injects the filler inside it, creating a roadblock.
Oh, no.
Or they inject so much filler tightly around a vessel that it compresses it from the outside, pinching off the blood flow.
And if the surrounding tissue doesn't get freshly oxygenated blood, that tissue begins to die.
Exactly. That is called necrosis. It is tissue death, and it is a severe complication.
So how do you spot it?
Well, a normal bruise from the cannula will look purplish, maybe yellowish or greenish as it heals over the days, and it generally feels a little better every day.
Okay, normal bruise stuff.
Right. The red flags for vascular occlusion are entirely different. You are looking for blanching,
Blanching.
yes, which is a stark, sudden whitening of the skin because absolutely no blood is flowing to that surface.
Wow.
Or, conversely, a dusky, mottled, bluish-gray discoloration that looks almost like a web forming under the skin.
I would imagine the pain is different too. The sources mention pain as a major indicator, but, I'd expect some pain just from the needles.
It is a very specific kind of pain, severe escalating pain that feels completely out of proportion to a standard cosmetic procedure.
Okay, so getting worse, not better.
Right, or a throbbing ache that suddenly gets much worse hours after the injection.
Hmm.
That is literally your tissue signaling that it's being starved of oxygen.
Terrifying.
If you see blanching, that dusky discoloration, or feel severe escalating pain, you do not wait to see how it looks tomorrow. You contact your practitioner immediately.
Because they can reverse it, right?
Yes. They have an enzyme called hyaluronidase that they can inject to rapidly dissolve the H8 filler and restore blood flow.
Hmm.
But time is tissue. You have a very short window before permanent damage occurs.
Aside from the immediate vascular risks, there are two other rare delayed risks mentioned in the FDA briefing that I want to understand. Delayed immune reactions, which they call granulomas and biofilms.
Yeah.
How do those happen weeks or months after the fact?
Well, granuloma is basically your immune system building a microscopic prison wall.
A prison wall.
Yeah. For reasons we don't fully understand, weeks or even months after the injection, your immune system suddenly decides the filler is a foreign invader.
Even though it's been fine for months.
Exactly. It wakes up, attacks the filler, encases it in inflammatory cells, and forms a hard, persistent, often painful nodule under the skin.
Wow. And a biofilm.
A biofilm is a bacterial issue, and it is incredibly stubborn. When bacteria enter during the injection, sometimes they don't cause an immediate infection.
They just hide.
Essentially, yes. They attach to the surface of the filler deep under the skin and secrete a slimy, protective matrix around themselves.
Gross.
Very. This biofilm acts like a shield. It can cause chronic low-grade infections and swelling that oral antibiotics really struggle to penetrate.
Because of the slime layer.
Right, because the bacteria are hiding inside the slime layer attached to the filler. The only way to truly resolve a biofilm infection is often to completely dissolve the filler with hyaluronidase and flush the area.
Which brings us to the absolute golden rule from all of the aesthetic clinics. We touched on it earlier, but it bears repeating when we were talking about any kind of lump under the skin. Never, ever massage a lump yourself.
Never. If you feel a lump after the initial 2-week settling period, let your practitioner handle it.
Right.
If that lump happens to be an encapsulated biofilm or an inflamed granuloma, and you start vigorously massaging it at home, you can rupture that protective wall.
And then it spreads.
Exactly. You spread the infection or the intense inflammation throughout the surrounding healthy tissue. Always let the medical professional diagnose and treat it.
So what does this all mean? We have journeyed through the intense, highly vascular 48-hour swelling phase, where ice is your best friend and coffee is your enemy.
True.
We've decoded the reality behind the no downtime myth, mapping out the very real lifestyle restrictions, from ditching your yoga pants to a potential 2-month ban on intimacy.
A big adjustment.
We've weighed the instant temporary gratification of hyaluronic acid against the longer, surgical but permanent path of fat transfer and angiogenesis. And we've highlighted the crucial medical red flags like blanching and severe pain that separate normal healing from an emergency.
It means that while labial puffing is heavily marketed as a quick, minimally invasive fix, achieving the physical comfort and the aesthetic confidence you are seeking requires a deep, informed respect for your body's healing process.
It's not just a quick trip to the salon.
No.
Mm-hmm.
The procedure itself might only take 30 minutes in a clinic, but the recovery is a biological commitment.
Respecting the downtime really is the ultimate key. But before we sign off, there's one final thing I wanted to ask about.
Sure.
We established that these HA fillers in the labia majora last anywhere from 12 to 18 months before the body naturally breaks them down.
Right.
Which means if a patient wants to maintain that specific volume, they have to go back and get re-injected over and over again, potentially for years.
It becomes a maintenance cycle, yes.
Mm.
And if we connect this to the bigger picture, this raises an incredibly profound question about the long-term mechanics of tissue manipulation.
How so?
Think about a continuous, decades-long cycle of artificially stretching that highly delicate, sensitive tissue with a hydrophilic filler, letting it deflate over a year, and then mechanically stretching it all over again. How might that continuous inflation and deflation impact the natural baseline elasticity of a woman's anatomy over her lifetime?
Oh, wow.
By constantly pumping up the tissue, do we eventually degrade the very structural integrity we are trying to enhance? It is something the medical community is only just beginning to track over decades of use, and a critical unknown to ponder.
That is definitely something to deeply consider as you weigh your options and look beyond the immediate results. Thank you so much for joining us on this deep dive. Until next time, stay curious and keep asking the hard questions.